Hello, and thank you for joining us on this Friday afternoon, October 17th, in commemoration of both World Poverty Day and the year-long commemoration of the 50th anniversary of the War on Poverty. My name is Kiana King Chikata. I am the Director of the Office on Socioeconomic Status, and I'm joined by my colleague, Julia De Silva, Director of the Violence Prevention Office of the American Psychological Association. We welcome you and are excited to present this webinar titled, Understanding and Overcoming Influences of Poverty on Children and Families. In short, our esteemed panelists will discuss how poverty as a toxic stressor gets under the skin, its consequences, and how to mitigate its effects. We are joined today by Dr. Daniel Marston, who is a cognitive behavioral psychologist and owner of Marston Psychological Services, LLC. His research and training interests are primarily in the areas of neurological and psychological effects of poverty. We are also joined by Dr. Roseanne Flores, who is a developmental psychologist and associate professor in the Department of Psychology at Hunter College of the City University of New York. Her research examines the effects of poverty on children's cognitive and linguistic development, the influences of parent-child discourse practices, and the relationship between environmental risk factors such as community violence and food insecurity on the health and educational outcomes of minority children. Again, we welcome you. We are very excited to report that we have over 1,000 registrants for this webinar. Please note that all participants will begin the webinar muted and will not be able to be heard. If you have questions, please write them in the Questions tab of the GoToWebinar navigation bar. Also, we have allotted the last 15 to 20 minutes of the webinar for questions and answers. We want this to be an interactive opportunity for you to be able to also ask and have our panelists respond to your questions. So please do take advantage of writing your questions in the Questions tab. Furthermore, this webinar is being recorded and it will be made available online at apa.org. In the event that we're not able to get to a large number of the questions that are asked, we will do our best to have a short question and answer supplemental sheet that goes along with the recorded webinar. And without further ado, I am going to go ahead and turn the webinar over to our first esteemed panelist, Dr. Daniel Marston.
Hello everybody, my name is Dr. Marston and I am going to be talking about the neurobehavioral and psychological effects of poverty. Okay, and I'm going to be starting the presentation now. As I said, I am doing the presentation on neurobehavioral poverty. I apologize, I'm getting things set up right now. Oh, there we go. As Kelly said, my name is Dr. Daniel Marston. I'm the owner of Marston Psychological Services, LLC in North Huntington, Pennsylvania. I am board certified in cognitive behavioral psychology. I am the owner of a practice to provide services in low-income areas throughout southwestern PA. I'm a licensed psychologist. I specialize in the assessment and treatment of neurobehavioral disorders. I am a member of APA's Division of Behavioral Neuroscience and Comparative Psychology, and I am that division's representative, otherwise called monitor, to APA's Committee on Socioeconomic Status, who is sponsoring this presentation. In this presentation, I will be reviewing statistics related to poverty and neurobehavioral and psychological disorders. I will be addressing factors associated with poverty and neurobehavioral and psychological disorders. I will be addressing neurological issues that are associated with poverty and their impact on behaviors, and we'll also be addressing ways that psychologists and other mental health professionals can help address those issues. In 2011, the U.S. Census Bureau estimated that there were 46.2 million people living below the official poverty line set by the government. The National Center for Children in Poverty this year came out with statistics showing that 20% of children live in poverty. That translates to more than 16 million children. Another 25% live in what would be considered near poor, which is 100% to 200% of the poverty level. What will be the essence of this presentation is addressing the higher prevalence of neurobehavioral and psychological disorders in individuals who are suffering in poverty. And I have a summary of a research article there from the journal Neurology, where the author studied the prevalence of intellectual disabilities across the world and found that intellectual disabilities occurred 3 to 5 individuals per 1,000 individuals in high-income countries, but almost 7 times as often in developing countries, 22 out of 1,000 individuals. And this would just be an example of the higher prevalence and how significant it is in areas where poverty is more prevalent. Moving on to additional research, Hetzner, Johnson, and Brooke Gunn in 2010 found considerable evidence that children from poor families were more likely to experience developmental delays than individuals from middle-class families. The National Health Interview surveys found that family poverty was associated with significantly higher levels of developmental disabilities, learning disabilities, and intellectual disabilities. And this would just be an example of research showing the significantly higher prevalence of neurobehavioral disorders in families suffering poverty. An additional part of that research was they looked at medical assistance and compared it to children who were being treated under private insurance, and found that children who were being treated under medical assistance had higher levels of ADHD, learning disability, intellectual disabilities, and developmental disabilities, which would be the category of autism. And this is relevant because all of those would be under the category of neurobehavioral disorders, which are behavioral disorders that have a significant neurological aspect to them. I have here, again, research showing higher prevalence of ADHD among children below the poverty level. And the research I've reviewed up till now has just been sort of an overview of the more significant numbers of neurobehavioral disorders in children suffering poverty. We'll now move on to discussing some of the neurological and psychological factors associated with poverty that may help to explain that higher prevalence. There was a recent article in American Psychology that reviewed how poverty is a critical risk factor for many mental, emotional, and behavioral disorders in children. And that research found that poverty was highly related to mental, emotional, and behavioral health disorders, independent of such things as parental education, race or ethnicity, and neighborhood conditions. So really underscoring that it was poverty and factors associated with poverty that explained the higher prevalence. Some of the psychological problems that were found to be more prevalent and associated with poverty were anxiety, depression, attention problems, and disciplinary problems. What what these authors, Santiago, Wadsworth, and Stump, and I apologize, there's a small error, that should be 2012, not 2002. What they found was that in adults in poverty showed a higher level of withdrawal, semantic complaints, and thought problems, pervasive negative thinking being an example there. These same authors then found that with children, the problems that were higher and associated more with poverty were social problems, attention problems, and attention and depression problems. What these authors and some other authors have explored is a possible underlying psychological issue. And that was that adults suffering poverty, many of whom are taking care of families, tended to be more impacted by worry and anxiety about what they were supposed to do and how they were supposed to handle the many stressors associated with poverty. Children, on the other hand, tended to be more impacted by feelings of helplessness and lack of control. They often see what their families are going through and feel they need to be of some help, but can't really identify any way of helping or having any control over the situation. In my own practice, we see this quite often. Adults tend to be very focused on trying to figure out how to handle the problems. Children, on the other hand, are very much impacted by wanting to have some control over the stressors or trying to figure out some way to help their families deal with the significant stressors. And this is one way of explaining how with adults many of the symptoms related to poverty are ones that tend to lean more in the anxiety area, whereas with children they tend to lean more in the depression area. Some of the physiological factors and psychological factors that have been associated with poverty and may explain some of the higher level of neurobehavioral and psychological disorders include such things as malnutrition, environmental factors, stress, and lack of resources. Some of the possible explanatory factors for why you would have higher levels of disorders when you get into some more specifics include protein energy malnutrition, dietary deficiencies, environmental toxins, and lack of early sensory stimulation. Now what we're getting into now are some of the more specific physiological factors that may lead to the neurobehavioral disorders and the higher prevalence associated with poverty. Maternal malnutrition is one of them, tends to significantly impact on communication and social disorders, also to a higher level of developmental disabilities. Lower brain volume in the hippocampus and the amygdala tend to be associated with poverty and could be a physiological explanation of the higher level of neurodevelopmental disorders. You see here another author, Evans and Schamberg, going through the findings that poverty is often associated with impairments in the hippocampus and amygdala and often lead to problems with working memory. Wilber and Wilber's colleagues have found a considerable amount of evidence about chronic stress and its impact on individuals in poverty. And this significantly impacts on the prefrontal cortex. Some other possible physiological factors that are related to impairments in the prefrontal cortex include deficits in executive functioning, cognition, language, sociability, and emotion. Farah, who is at the University of Pennsylvania, is certainly one of the most prominent names in studying the neurological impact of poverty. really found the strongest evidence of how the prefrontal cortex is impacted when it comes to poverty. And this actually helps to explain a large degree of the neurobehavioral disorders. You see here some additional evidence about how the prefrontal cortex impacts executive functioning when it comes to poverty. Poverty is associated with increased stress physiology, and I have here a summary of some research addressing that. Chronic stress has a significant impact on the hippocampus, which really can affect how individuals deal with new challenges and handle stressful situations. Chronic stress and its relation to poverty has in the end really been found to be a significant factor when it comes to neurobehavioral disorders and poverty. Some of the chronic effects that can be associated with the high level of stress and poverty include maternal deprivation, nutritional deprivation, noise, carousing, housing problems, and diminished cognitive enrichment. So what we have here is these are the factors associated with poverty that really impact significantly on the neurodevelopmental factors associated with childhood and really impact on the development of neurobehavioral disorders. So in the end, what we have here is poverty relates in large part to impairments in the hippocampus, amygdala, prefrontal cortex, and relate directly on executive functioning, working memory, social comprehension, and emotion regulation. And this then leads to higher levels of autism, learning disabilities, ADHD, and intellectual disabilities. Poverty and the chronic stress associated with poverty, Fuller et al. In 2002 found that 13% of that could be related directly to perceived social class discrimination. Individuals in poverty often are under a lot of stress because they perceive themselves as being treated differently because they're poor, and this is often because they actually are treated differently because they're poor, and that involves a considerable amount of stress, which impacts significantly both on psychological and neurological development. Some of the I'm moving here forward on the issue of access to behavioral health services. Many individuals in poverty lack access to behavioral health services, and often this is because they do not recognize the need for it. Mental health services are seen as a specialized service, and many families do not see the need for this beyond what they already get from their medical practitioner. There has not been found to be many types of approaches that really help to address the impact of poverty, but some ways that are likely to be helpful include Head Start, as they address developmental and behavioral problems early, services that are more convenient for families, comprehensive assessment strategies that are cost-effective and time-limited, helping children and adults with coping skills, helping children with feelings of helplessness, and helping adults find ways of obtaining needed resources in stress management, offering multiple types of assistance, helping to address nutritional deficits, showing recognition of the complex issues that involved, and also taking a non-judgmental attitude to people suffering in poverty. That is the end of my presentation, and I thank you very much for listening.
Dr. Flores?
Hello?
Hi, Dr. Flores. Okay, we couldn't hear you. I don't know if you had started, but I didn't hear you earlier, so you may want to start over from the beginning.
Okay, I will. All right. So good afternoon, everyone. And I'm going to be addressing the influence of poverty on children and the families in the context of communities. So I'm going to begin with a story about Michael and Gabrielle, because I think it's important to lay the context for what I'll be talking about this afternoon. And Michael and Gabrielle are 18-year-olds, and they're expecting the arrival of their first child. Michael is in the process of completing high school, and Gabrielle has stopped going because she's been sick throughout her pregnancy. Michael works part-time while going to school and still lives at home with his family. His parents are older now and no longer work. Because he does not have a full-time job, he does not have health insurance. He's trying to finish school so he can get a full-time job and save enough money and move out of his parents' home. He wants to support himself and his new family. Gabrielle lives at home with her mother, who is struggling to take care of Gabrielle and her baby sister. They have a small apartment, and the rent has just gone up. Gabrielle's mother is worried because she does not know how they will take care of the new baby. Gabrielle is unable to work because she's been sick, although she sometimes watches her younger sister, so her mother does not have to pay for child care. Gabrielle goes to a health clinic when she can, but she sometimes skips appointments because she does not have enough money to get to the clinic. Michael and Gabrielle are anxious because they do not know how they will support their new baby. They want to be good parents, but they don't know how they will be able to make it under the circumstances. If things get worse and nothing changes, the new baby will be born into a family living in poverty. So today, for my presentation, what I want to do is look at families and children living in the United States in poverty, talk about the individual and structural determinants of poverty, look at the cycle of poverty in families, address some of the indicators of child well-being, examine the consequences of poverty and on child and family well-being, and then talk about fostering resilience in children and families. So as you can see, looking at the federal poverty guidelines, for a family of 4 living at 100% of the federal poverty line, that exists of approximately making $24,000 a year. At 133%, it's about $31,000. Again, $35,000 at 150%, and approximately $48,000 at the 200% of the federal poverty line. And I want you to sort of keep that in mind as I go on throughout the talk. So we're going to talk about some facts about family poverty in the United States. Families living between 100 and 200% of the federal poverty level are at risk for missing rent and bill payments, not having access to adequate child care, running out of food, and having poor quality health. Single-parent families have a greater risk for experiencing economic hardship than children living in 2-parent families. And then lower levels of parental education also contribute to lower incomes and to poverty. As you can see, using data from the Annie Casey Foundation, that all families from 2009 to 2013 were living approximately at 15% of the poverty level, with a dip happening about 2013. But if you look at single-family families, they're at the highest level, at the 35% mark, and they were pretty stable from 2012 to 2013. And then married couples also have a high level of poverty, but the dip starts to happen again in 2013. Some facts about child poverty. Children growing up in poverty are at the greatest risk for experiencing poor developmental outcomes, some of which you heard in the previous presentation. They're at risk for having poorer health care and nutrition, so many children will suffer from food insecurity, not having access to food in a proper and social desirable way. They're at greater risk for experiencing poor health outcomes, whether that be at the level of asthma or at the level of other health conditions. In terms of education, they have poor educational, cognitive, and social emotional outcomes, as you've just heard. And they also have limited access to high-quality education, and that's from birth throughout the college years. They're also at the greatest risk for experiencing abuse and neglect, as well as at being at greater risk for being exposed to and victims of violence. Children at the 100% poverty level, as you can see from the statistics, from 2009 to 2013, sort of increased to 2012 and then dipped a bit in 2013, but they're still pretty high at 20%. Children living in areas of concentrated poverty, and that's where you have neighborhood overcrowding, pollutants and toxins and the like, have increased over time. So from 2000 to 2006 to 2007, finally to 2012, you see an increase of children living in areas of concentrated poverty. Now what I want to do is to talk about some individual and structural determinants of poverty. And we sometimes think about this in the context of determinants of health, but I wanted to frame it in the terms of the context of poverty. So when you look at individual determinants, what you have are limited access to education, fewer financial resources, fewer social resources, poorer health, greater exposure to stress, and limited income. But those are actually related to the structural determinants. You have limited access to quality health care, poorer neighborhoods, limited access to high-quality education, limited access to high-paying jobs, insufficient housing, and higher exposure to community violence. So those two things are actually interrelated, and the structural affects the individual and then vice versa. When you start to address the cycle of poverty in families, what you can see is that poverty affects family circumstances, which are also affecting poverty, and then family circumstances affect child well-being, which is also affected by poverty. When you look at the indicators of child well-being, we have 6 dimensions that we need to think about. We need to think about material well-being, housing and environment, education, health, risk behaviors, and quality of school life. And when you think about that, those are some of those structural determinants that I just spoke about previously, but that also affect the individual determinants. So let's talk about some consequences of poverty on child and family well-being. We've talked about this before. We think about poverty as being viewed as a toxic stressor or a chronic stressor. An exposure to ongoing stress can result from exposure to violence, limited access to economic resources, severe poverty, instability within families and communities, and all of these affect child and family well-being. Families living in poverty tend to live in overcrowded neighborhoods. Their environments are exposed to chemical toxins. They have communities with limited cultural, social, as well as financial capital, and they have a greater exposure to violence. Some consequences as we look at these things is when you have an accumulation of all of these factors together, so it's not just one risk factor, you end up with poorer health outcomes for both children and families. So what can we do? I want to suggest that children and families, just like toxic stress, not all children who are exposed to toxic stress or families exposed to toxic stress will actually end up in a place of poverty for all of their lives, but for the most part, some children and families may be resilient. And we have to talk about this notion of resiliency and working to support children and families. So resilience then is going to involve the ability to do well in the face of adversity and trauma. Resilience is not innate, and it can be fostered in children and families, and that's important to understand. So how can we help to foster resilience? Well, we can start at the individual level. It should be fostered at the individual level in working with children to develop problem-solving skills, social competence, and confidence. At the family level, it should be fostered by working with families to develop warm and engaging relationships and social supports. At the community level, it can be fostered by helping children and families develop supporting relationships with the members of the larger community. So then when we look at this group, we can no longer just look at it at the individual determinant level. We must look at it as an integrated whole. So supporting family and child well-being is going to take an integrated approach. We need strong communities, and those strong communities then will relate to strong families, and those strong families will relate to thriving children. At the end of the day, what we want to have is a family that's supported by all, so that by supporting an integrated family and members of the community, families like Michael and Gabrielle will have a fighting chance. And with that, I'm going to end so that we can open it up for some questions.
Wonderful. Thank you so much, Dr. Flores and Dr. Marston. We do have some questions that we'll start with. The main question that people have been asking is whether or not the slides can be made available. And the answer to that is yes, that our office can definitely send that information out to the registered participants via email so that you can have access to those slides. The other question is about the presentation. I mentioned this earlier at the very beginning that yes, this webinar is being recorded and it will be available at a later date on our website. It will not be in the next couple of days because there's a process where everything has to be transcribed before it's made available on our website. So once the transcription is available and everything has been approved through our ITS department, it will be uploaded. So my guess is that that could take about 2 weeks, hopefully within that time frame. So now questions for our panelists. The first question is from, and I apologize if I mispronounce anyone's names. I will do my best. It's from Sunita Patel. And the question is, what are some optimal standardized measures of SES to use in research? I have used Hollinshead previously, but it is also outdated.
I'm sorry, could you say the question again? What are measures of?
Optimal standardized measures of SES to use in research.
Of socioeconomic status, is that what, did you say SES?
Yes, socioeconomic status.
Socioeconomic status. Huh.
Well, I would answer that question by saying that, in fact, for me, I use large data sets, and more often than not, composite variables are made so that we don't just necessarily have a straight standardized variable. You're creating the variable with income and education and prestige and the like. So I would think that if, depending on what kind of research you're doing, sometimes if you're using large data sets, those variables are made already, and you're not just using them.
Hello? Oh.
Wonderful. All right, next question. Is there a control for the statistics of children in poverty that do have higher levels of mental health issues, and that these children are more likely to be involved with social services, which includes psychological testing, or they are involved in the criminal justice system that requires treatment, whereas children in higher income households are less likely to be involved in these services? Parents in poverty and lack of education are more likely to have behavior problems with children that lead to services that lead to diagnosis. That question is from Mandy Weirich.
Okay. And Dr. Flores may have a response to that, but my strongest response to that, and this is something I think is very important, is it is not the case that just because someone is in social services or in the criminal justice system, it is not always the case that they are receiving quality mental health services or mental health assessment. That would be my general statement, that what has come out from the research on these programs, and I had done a whole presentation on assessment, which is something I mentioned here, but previously I had done one on assessment. What had come out in the research is that the assessments being done were not high quality ones. They were not, you could find many, many programs for social services and for the criminal justice system where the person doing the assessment is not even a psychologist. So, you know, now that doesn't always mean that the assessments are bad, but certainly psychologists are the ones primarily seen as most trained in doing psychological evaluations, and or we're not even licensed mental health professionals. So there, it is what has come out in the research when they review these programs is that there's a high level of inconsistency in social services and in the criminal justice programs of the quality of evaluation and services that are being provided.
I also think part of the question is something about a control and who would be part of the group and who would you be missing, if I get that right. I think that's part of the question. And I think yes, when you're looking at the data, particularly the kinds of data that I was talking about today, which is national level data, you're sometimes missing a group of individuals who don't access services, right? So they wouldn't be part of the data system. And they may be being caught by private mental health providers and the like, but they might not be part of the overall system. So I think, you know, yes, when you're looking at data, you have to think about that.
Okay, thank you. Next question. Are the physiological effects thought to be because of the poverty or actually lead to poverty? For example, the hormone levels, memory issues, smaller hippocampus. That question is from Elizabeth Leonard.
The research that I reviewed and the most prominent research, and certainly the article in the American Psychologist that came out just recently, the one I cited in the presentation, would really underscore that it is the impact of poverty that leads to these problems. In part of why I say that so directly is because much of the much of the study on the neurological impact has been on child development. You know, so there's sort of, in effect, one of the articles I cited there on the stress level was before 1 year of age when it started. So this is where a lot of the studies of impact of poverty come from, and certainly studying children would suggest that it's poverty impacting on them rather than their development leading to poverty. So I would say that the research strongly leads in support of the of stating that it is the impact of poverty that leads to these factors. Now, that also, just as another note there is certainly a circular nature to it, that individuals, in fact, that could be seen as one of the major problems, that it can lead to being trapped in a cycle, in that poverty leads to these development of, say, intellectual problems, developmental problems, attention problems, and then that might make the individual less likely to be able to get out of poverty, to do the things that they would need to get out of poverty, and thereby leading to a circular nature to it. So that would be a factor as well.
And I would agree, and I think that's what, when I was talking about looking at those individual determinants, right, versus the structural determinants and the interaction between them, right? So there are things that the individual comes with, but then the environment affects that, and then that becomes the cycle, right? So the poor access to education is going to lead to poorer job skills, which is going to lead to poorer outcomes, which is going to affect, so it becomes a cyclical process on top of the logical foundation.
Right.
Hi, this is Julia Silva. I'm the director of the Violence Prevention Office. I just wanted to add something, to this discussion, is that, the association between poverty and harsh parenting practices. That is the association also that you see that parents who are stressed by their level of poverty, helplessness, difficulties, mental health issues, and lack of social support, they are more likely to use harsh punishment and harsh disciplines with their kids, and many times using physical discipline. This is one of the issues that there is extensive literature in terms of what is the connection between poverty, stress in the family, and ineffective, harsh parenting styles and child maltreatment leading to, those outcomes in the kids. Also, negligence, because, neglect, it is a very important consequence of poverty, that the families who cannot provide the basic needs for their kids, this has also outcomes for the kids. So I just wanted for us to make all these connections that these, the poverty is the social determinant of situations that have like a continuing of influence, impact on children's behavior. And I think, it's important for us to have clear what is this chain of events and associations so we can understand what are the children outcomes in very low income and desperate, stressful, toxic environments.
And I would agree with that, and hence why I also want to say, though, that you look at the resiliency component of that, right, which then is providing those supports for families so that they can provide those supports for their children. And so that comes at the community level of addressing community violence, right, which will then also fix some of the neighborhoods and then provide support for families, and those families will provide for supports for their children. And so we want to move away from this notion of the notion of mental illness and what have you into looking at child and family well-being, right? And that child and family well-being will happen in the context of all of those areas. And so then, so not but to draw on also the resiliency factor of how can we help children and families in the context as we try to shift some of those other determinants.
Related to the answer of that question, Lori Knitter asked, what are some resources that we can share with families about building resilience? Can you give us some examples of where we can find this?
Well, the APA, the American Psychological Association, which we didn't talk a little bit about, has a great deal of resources online for resiliency. And Julia, you can also talk about the Office on Violence and what resources that you have available. Child's Friends has also done a wonderful report on child well-being for that again as well. And then I would also advocate that folks look to Head Start to look at the notion of strengthening families and how we can support families and family engagement. And I think that's also a big part of this as well.
Wonderful. The next question has to do with, and it's a series of questions that have to do with schools and programs in schools. So part of that is what are some of the evidence-based practices in schools, and how do we get families invested in encouraging their children to participate in these school programs? That's from Butler Knight and Tosh Saraguchi.
So Daniel, do you?
Well, I mean, that's, I mean, working a lot with schools, I mean, in a lot of ways, that's the million-dollar question. I mean, there are these great programs out there, but sometimes getting families involved and committed to it can be very difficult. What I would, I think. My experience, my review of the research, my experience would all point to if there's a disconnect between what the people running the programs are hoping to do and what the families who are being looked to in terms of participation, if there's a disconnect, it's often that the families do not see the real practical benefit. The question of how really is this going to help me is something that they don't necessarily see, and so and it's certainly a complex issue, but what I would say is that if there's an area to focus on, it's figuring out how to make it practical as far as use and being very clear, being very specific on what this is likely to do, and also making it, and I mentioned this in the presentation, the issue of making it as convenient as possible.
I would also argue, so that the federal government, for example, has some grants, such as the Promise Neighborhood Grants, which looks that would go from birth to college, and you would obviously look at strengthening the neighborhoods. And I go back to this notion of communities, right? Schools are part of communities. They're part of the larger communities in which people live. And so as you strengthen neighborhoods and you provide resources and you provide change in structures, this also benefits the children, and it's linked to the schools. SAMHSA also has some grants, Project Launch, for example, which is the integration and coordination of early childhood services. So things of that nature would be the ways that I think people could work within communities and schools to foster development in children and support families.
Thank you. Next question from Holly Paolacelli. In your research, have you found differences between rural and urban poverty in children and families?
Yes. Very often, mainly in the area of not necessarily the actual neurobehavioral impact of poverty, but more in the benefits from services, primarily related to the whole issue of lack of access. If there's one issue that I've seen really be the distinguishing factor between rural and non-rural, it's the issue of access.
Right, and again, I would say that particularly, again, if you're looking at children and very young children and families, there's been a tremendous amount of work on that, which basically gets at that point that children in rural areas have limited access and fewer things available to them than children, in fact, in urban areas. And sometimes greater health disparities as well because of that.
I'm sorry, there are a lot of questions. Next one is Mandy Weirick. What one thing can social service agencies do to increase resiliency in these children and families? If there had to be one thing, what would be the most important thing?
So from my perspective, I would argue that building support through nourishing and fostering relationships, right? Because those relationships are going to be the foundation for not only just for families, but for children. And I mean those relationships outside of the families, right? So connecting families to community supports, which then provide those supportive resources that families are sometimes lacking, right? And that gets back to the earlier issue of harsher discipline and more violence, right? Well, when you're stressed, you don't have access to those supports. So I would argue that building those supports, building those relationships, which then could help to strengthen families, and in strengthening families, you would strengthen children.
And I would say provide consistency in whatever way you define that as much as possible. Even if you have a small number of resources, if you can make it clear that this is going to be provided on a consistent basis and in a consistent way, that seems to be the one thing that helps the most.
On the back of that question, one of the things I didn't address in the presentation, because there's a lot of things to do, but one of the things is consistency, and that was an issue that was raised before about families and children, right? So routines, we know that routines are important in the lives of children and families, and sometimes families living in poverty don't have those nice, neat, stable routines because they're either juggling or balancing jobs, they don't have access to proper child care, so they're scrambling around for that. So again, providing those supports can help families provide routines for their children, and we know that those routines are necessarily for good development in children and families, such as eating practices and family meal time.
Thank you. Next question, Stephanie Griffith. Dr. Marston, could you expand a bit more on the connection between poverty and autism?
Yes. I in fact did a presentation on this specifically a while. The connection between autism and poverty actually has been sort of an up and down as far as where the evidence points. There actually was at one point quite a bit of evidence suggesting that there might be less autism in poor areas. It wasn't quite clear why that would be the case, and further research indicated that it was more an access to services type issue. Where it really comes down to is there does seem to be a higher rate of autism among poorer families, and autism is a neurological condition. First and foremost, that's what it is. It's a neurobehavioral disorder. So because poverty affects those areas of the brain that are most related to autism, there would be a lot of reason to believe, a lot of support for there being a higher level of autism in poorer communities. So my general statement to that, but also hopefully expanding, is autism is a neurological condition. The parts of the brain that are most directly related to autism are also ones directly impacted by poverty, and that would be a supporting factor for why there does seem to be a higher level of autism in poorer families.
Thank you. All right, I'm going to change gears a little bit. From Nicole Johnson, what are some effective methods to improve community-level resiliency?
Well, again, I mean, this is about partnerships, right? And again, if you think about communities, the part of working within communities, which would be getting everybody on board, because poverty, as we know, is multi-integrated. It's not just a one-pronged approach to dealing with it. So that would be partnering with businesses. That would be partnering with the federal government. That would be partnering with private institutions to build communities that would support, okay, families. And then part of that is, as you build the communities up, right, families then may be able to have access to jobs, and those access to jobs would be provide the income so that they could actually use the income that would provide for their children. So I think it's about building partnerships. I really do think it's about building the partnerships there, and that's the supports in the family, the supports in the community. And it's also with working, you know, again, one of the other factors that wasn't raised is this is, you know, about social and emotional and physical and spiritual health. So it's also drawing on those resources in the communities. You know, the houses of worship that are in those communities, bringing those folks on board so that maybe they can provide additional support to families. So I think everybody needs to be on board. So it's sort of like getting everyone to the table, the community, and then working with that group to say, okay, what can we do to support children and families, and that will ultimately support the community.
Thank you. Next question is from Dina Kastner. How do we know that children in poverty are exposed to violence? I thought violence was evident across SES.
Well, yes, it is. It is across SES, but it's when you look at the statistics for neighborhoods in terms of violence, what you do is you actually see higher levels of violence in impoverished communities, and some of that might be limited resources and what's available, what's not available. So you know that's the data. The data talks about that. If you think about areas that are really impoverished and severely, where we have concentrated poverty, so then what resources are available within those communities? And I sort of alluded to that in one of my slides. So that's lack of access to grocery stores. That's lack of access to playgrounds. That's lack of access to just regular stores. And what do you sometimes have? You actually have higher levels of substance use and higher levels of gangs and the like. So those things are actually correlated to higher levels of violence.
This is Julia Silva with the Violence Prevention Office. The data that we have about, you know, child maltreatment and youth violence come from referrals and reports that come into the Child Protective Services. So those are mostly from low-income families. So if you look at the Department of Health and Human Service child maltreatment report that they have, every year, that's what we find there. Of course, there are a lot of people that say, well, poor people report more, or, they have, the police or the social services or the social workers or the school counselors, they have a way to know that their kids are acting out. And there is no other resource but referring them to the Child Protective Service for them to find something to do for this kid. Whereas more affluent families, when their kids are acting out of the school, they are referred to a psychologist or to a treatment or to medication. So, this is a socioeconomic issue that, we deal with. But to tell the truth, the data we have is collected mostly from, low-income families. That's how we know. And also because, all the issues related to and the interventions that, psychologists have done, they primarily focus on, if they focus on primary prevention, secondary prevention, we go to at-risk communities where the statistics are higher and the data that we have about incidents are higher for communities at risk.
So again, I would argue again too, as on the back of that, those same communities also lack resources. So those are communities that are also severely under-resourced at the financial capital, the social capital, as well as the
All right, we have one, there were a number of questions that talked about psychologists and general public and how they can get involved in policy and advocating for policies around Head Start and a number of programs. There were dozens of questions in that area. So we've asked one of our colleagues to join us, Amalia Corby Edwards. Is going to talk to you a little bit about APA and what APA does to lobby on these related issues, and also, I guess, how you can get involved or...
Oh, yeah, absolutely. So I'm just stepping into the call, so I apologize if I repeat anything that's been said. Just to give you a quick overview of what we're doing in the APA Public Interest Government Relations Office. I work on children, youth, and families issues, and my colleague Roberta Downing, who is not able to join us, works on poverty issues. So some of the things that I've been working on include supporting a home visiting coalition. That's a broad-based group of organizations that are supporting reauthorization of the home visiting program that was in the Affordable Care Act. The CCDBG reauthorization, which hopefully later this Congress, that's the Child Care Dependent Block Grant. And that's something that we've asked our people that are in our Federal Action Network, which includes psychologists and other members, to contact their members of Congress. And so we've gotten involved that way. A bill that we were supporting earlier this year, HR 4980, which I don't have in front of me, is, I think, Strengthening Families and Preventing Sex Trafficking Act is the approximate name of it, supports transitions for foster care youth. And it's actually a fantastic bill that provides some funding for tracking of these youth so that they do not, so they aren't, I'm trying to think of the right way to word this, to avoid having these youth fall into the trap of being sex trafficked. There's also funding for transitioning the youth out of their group homes and out of foster care so they can have a Social Security card, driver's license, and other documentation to help them transition into a normal adult life. Some of the things that Roberta's been working on that I'm a little less familiar with is that we did have a congressional briefing on the stigma of against the long-term unemployed and its psychological effects. APA also weighed in to support raising the minimum wage and to extend unemployment benefits. And we endorsed paid sick days legislation and paid family medical leave legislation.
Thank you so much, Amaya. So I am so sorry that we have come to the end of our time, and I want to be respectful of everyone's Friday afternoon. Unfortunately, we were not able to even get to half of the questions. There are a number of great questions. We will try to respond to them and make that Q&A available online. Thank you so much for participating. We will be sending out copies of the presentation as well as information for accessing this presentation online. Thank you again, Dr. Marston and Dr. Flores. If you have a 10-second last word, you can say them now.
I want to thank everybody who took their time out this afternoon to listen to this very important topic. And I look forward to all the good work that you all will continue to do.
And I just wanted to say thank you as well, and I'm very happy to see all the interest in this topic and interest in moving forward and helping families in poverty.
Thank you.